I want my audience to know we're going to be talking about busting the myths around weight loss medication. Okay, Dr. Craig, you're taking on a real controversial subject here, so let's get started. Let's talk about the impact of obesity on our overall health, because since we're a society that is considered to have this problem.
Obesity is one of our most common chronic health issues in the U.S. today. We estimate that about 1 in 3 or even up to 40% of our population has obesity. And this causes many illnesses such as type 2 diabetes, heart disease, and even several cancers. Losing weight, even 5 or 10%. Now, more is better, of course, but even losing 5 or 10% starts to decrease or reverse these problems.
Given up on the fact that exercise and diet and good thinking can help us combat this problem of obesity? Have we given up on that? Just let's go to a different method?
We have surely not given up on that. We still have to do that. But many people who are struggling either can't lose weight doing those things, or they lose weight and then they gain it back, and they lose weight and they gain it back. And so if you fit one of those two profiles, then add a medicine in there. It helps so much to decrease the hunger.
Tell me what a GLP-1 injection is then.
Yeah, absolutely. A GLP-1 is glucose-like polypeptide type 1. It does a lot of things in the body, but the number one thing it's doing is decreasing appetite, allowing you to adhere to the diet that you really want to. It works a little bit on the insulin system and on the stomach, but at the end of the day, it's decreasing hunger for us.
What are the statistics behind this? And what I'm asking is, okay, you sign on for the injections. Do you take them for a lifetime, or you take them a certain time and then you go into the diet and the exercise? How does that work?
Yeah, I think that's a great question. I get asked all the time. So the first thing I will tell you is we're doing this because we haven't been effective at just diet and exercise, of course. So decide to take them for months, maybe 6 months to 12 months. Now, at the end of that time, if you're doing better than you've done in the last 5 years and the last 10 years, and you want to stay on the drug, just stay on the drug. It's decreasing your appetite. If you don't want to stay on the drug, and many people don't, let's work with your healthcare provider to decrease your dose. We'll wean you off of it. And then we're going to watch your weight, and we're going to watch it on a regular basis. And if you gain even 5 pounds, let's just put you right back on.
That sounds good. Are there any studies or statistics about the effects of taking the injections? And I'm just asking because I have found out as I'm moving into a different age group, everything has a side effect.
Well, absolutely. You know, weight loss drugs, the big myth is that they have dangerous side effects. Like all medicines, there's a risk of side effects, but they're really with the GLP-1s only 3, and they're quite mild. Number 1, a little nausea, heartburn, or constipation. With a little dose adjustment or a few over-the-counter medicines, it's really overall can be a mild thing. The benefits of these drugs at the end of the day far outweigh the risk for many, especially when we talk about the other health concerns that come with being overweight. At Hims & Hers, we believe in a personalized approach. 1, emphasizing obviously your weight loss, and 2, decreasing your side effects.
I want my audience to know I'm speaking with Dr. Craig Primack. He is a senior VP of weight loss at Hims & Hers. Tell me about Hims & Hers. You guys, what you call a holistic approach to weight loss. What does that mean for us?
So we believe that there's a no one-size-fits-all approach to health and wellness. We at Hims & Hers have developed a personalized weight loss offering that really looks at 2 things, affordability and effectiveness. And for this, there's a couple things to know. Our new offering are GLP-1 medications. They are science-backed and doctor-developed, available 100% online, and for as little as $199 a month. Through our app, you get connected to a licensed healthcare provider in your state who work with you to decide on the best treatment for you. And then they're there to give you realistic nutritional tips to follow snack and meal ideas. And then there's an app that has several trackers, even one with steps and a protein intake to make sure you're getting your activity and proper nutrition for the day. And then I think what you alluded to is when starting treatment, we always prioritize the safety for every patient by ensuring that we're giving you syringes for the GLP-1s that are sterile, that they come from FDA-regulated suppliers, and that the injectable medications, especially in the summer months, are shipped protected and with ice packs to make sure it's ready to go when it comes to your house.
Okay, I'm going to take this one from Facebook, and the poster wants to know, are there any preconditions that are required to start taking the GLP injections?
Yeah, absolutely. Great question. So two things. Number one is, what is your weight? So we use body mass index for that. And if your body mass index is 30 or greater, you qualify. Or if you're 27 or greater, and several of the weight related, we call them comorbidities. If you have blood pressure, cholesterol, sleep apnea, diabetes, prediabetes, those kind of things, you also qualify. That being said, we do have other medications for people who don't meet those criteria.
Where can my audience become more educated about the GLP injections before maybe they start the program?
Yeah, for more information, for men, go to hims.com/GLP1. And for women, go to forhers.com/GLP1.
Well, Dr. Craig, this has been very interesting. I look forward to you coming back to the Valder Beebe Show as your process and your program gains just phenomenal recognition. Thanks for being my guest today on the Valder Beebe Show.
Thank you, Valder.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.